And mommy is old.
Shut up, you know, little bricks.
Hello? Boss, I don't think I can go to work today. I just have pain everywhere. What do you mean I should stop whining? Just don't understand.
Oh my god, honey, just stop whining. You don't understand what I feel.
Do these symptoms describe you? Then it is possible you may be a sufferer of fibromyalgia. We here at Alno Clinic try to provide the best possible care for our patients so they start feeling better soon and keep their symptoms under control. Alno Clinic is the leading researcher on the topic of fibromyalgia and advancing its understanding in the medical community. Founded in 1997 by Alice McGinty and Noah Netterfeld, it has already helped hundreds of patients overcome their painful symptoms and has been a leading research facility over the decade. Here at Alno Clinic, we can also help you. So please, give us a call at 903-66200-1287. But what really is fibromyalgia, and how do you know that you have it? This video has been created for you by Alno Clinic in an attempt to inform you on all things fibromyalgia. Here are some quick details on fibromyalgia. Generally, it is a musculoskeletal condition characterized by a disorder in the pain processing mechanism and is characterized by a wide set of symptoms, which you may or may not experience. These symptoms can include muscle and joint pain, fatigue, sleep disorder, bowel and bladder sensitivity, and depression and isolation. However, not all of these are felt by every patient. It is defined as a syndrome with signs, symptoms, and medical problems. However, it is not a disease. The root of the word comes from Latin, fibro, which means fibrous tissues, and the Greek myo, meaning muscle. The Greek algos means pain, so the word literally means muscle and connective tissue pain. Generally, it affects around 2 to 4% of the population, with a 9-to-1 ratio of female to male. It is most commonly diagnosed in the ages of 20 to 50 years old. However, the number of people affected is not very clear due to the incredible difficulty of diagnosis and its misunderstanding by the medical community. There is no cure for fibromyalgia. The symptoms, risk factors, causes, the diagnosis and its difficulties, as well as the treatment and future developments, we are proud to present Dr. Leslie Scott, who will explain all of these details to you. Thank you so much for taking the time to join us today, Dr. Scott. Thank you so much for having me today. First, I will talk about the symptoms. There is a very, very wide range of symptoms associated with fibromyalgia, not all of which are experienced by every patient. This is partly why it is so hard to diagnose. Also, these symptoms are often mistaken for other disorders. The most common symptoms include achiness all over, as if the muscles are overworked, twitching, burning muscles, or stabbing pain, crippling fatigue, even upon arising. This is not simply women who do not want to go to work. Painful tender points in the body. Which we will get to later. Swelling. Disturbances in REM sleep. mood disturbances and depression, abnormalities in bowel function, pain while swallowing, memory and cognitive disorders, also known as the fibro fog. Symptoms can also include headaches, temperature sensitivity. To this date, there are no specific tests that can diagnose the condition. A series of tests must be done to rule out other possible disorders. Fibromyalgia can sometimes be tough to diagnose and is very often misunderstood by the medical community, which can delay good treatment. Often, it takes more than 3 years for a fibromyalgia patient to be diagnosed. In the past, millions and millions of fibromyalgia patients were misdiagnosed. Well, I have to say, I think you have rheumatoid arthritis. Definitely lupus. Are you sure you are not depressed? Okay then, I will take you for hypertension and sclerosis. Okay, I don't know what you have. These disorders may share some similarities with fibromyalgia, but they are not the same. So treatments for these disorders do little to help a fibromyalgia patient. Sally, I don't know what it is. I've been to 5 doctors. 5. And each of them give me a different diagnosis. I've tried everything. The pain just won't go away. Maybe I'm just imagining it. I don't know what I can do. Often leaving them disheartened and feeling like the pain is all in their mind. The problem is sometimes ignored by the medical community. This is because it is a problem affecting mostly women. And since fibromyalgia is characterized by a heightened sensitivity to pain, it is simply believed women are exaggerating their symptoms. Stop complaining! You only have pain. Everybody has pain. In order to diagnose the condition, other disorders must first be ruled out. The American College of Rheumatology have established 2 criteria for diagnosing fibromyalgia. They include a widespread history of pain, which means pain in all 4 sections of the body, that lasted over 3 months. The presence of tender points in the 18 sites of the body, which I will now illustrate. At least 11 of these tender points must feel tender if 4 kilograms of pressure is applied. Fibromyalgia patients may also feel pain at other points, but the pressure points are the main ones we are looking for. These tender points occur in pairs of 2 and are located on the bottom of the neck, the shoulder blades, the elbows, the lower back, just beneath the buttocks, and the knees. Other ways in which doctors rule out other possible conditions and get closer to diagnosing fibromyalgia include the explanation of the symptoms, a blood test that identifies markers produced by the immune system blood cells in people with fibromyalgia, complete blood tests that measure hemoglobin, red cells, white cells, and platelets. Using this test, your doctor can rule out other common blood disorders such as anemia, which can also cause fatigue. Thyroid test checking if the thyroid is underactive can also be applied. Kidney and liver tests to check blood chemistries are common, and usually your doctor, if it is very hard to find the condition, will also take a check of cholesterol levels and calcium levels. The causes for fibromyalgia are unclear. However, a wide range of theories exist. Some possible causes for fibromyalgia could include stress, illness, or trauma, which is usually a form or a combination of emotional stressors, the possibility of a hereditary gene, which is passed on from generation to generation, which causes people to react intensely to stimuli which would not bother another person. Lower levels of brain neurotransmitter, called serotonin, leads to lowered pain threshold and an increased sensitivity to pain. Additionally, which is a very recent theory, the increased presence of a chemical called substance P, which amplifies brain signals. However, all of these causes are only speculative, and the true cause still remains a mystery, which is why many people believe fibromyalgia does not even exist. Once the condition has been diagnosed, you can get treated, and I strongly suggest you let Alno Clinic help with your symptoms. The doctor here at Alno Clinic will most likely prescribe a multifaceted treatment program that includes medications, exercise, stress reductions, sleep strategies, acupuncture, behavior modification therapy, and diet. Also, pain relievers such as acetylsalicylic acid, antidepressants, and amphotericin and fluoxetine can also be prescribed if the patient suffers extreme pain or is depressed or anxious. The treatment is mostly about teaching patients to cope with their situation. However, true effort from the patients is absolutely necessary in order for the program to work. Only then will the symptoms start to lessen. Sadly, some insurance companies even deny fibromyalgia exists, so they do not cover it. However, if you have grade 1 or grade 2 insurance, Alno Clinic would be happy to welcome you without any additional costs. Recently, here at Alno Clinic, we have also added Tai Chi, which in many tests have been proven to help fibromyalgia patients extremely when coping with their pain.
Remember, even if you do not suffer from fibromyalgia, but you believe that you may be at risk for it, Alno Clinic will be happy to diagnose you and assess your risk level. Remember, you are at risk for fibromyalgia if you are a woman, a relative has the condition, you have a history of a rheumatic disease such as rheumatoid arthritis or lupus, you experience high levels of stress due to a very stressful culture or environment, or you're psychologically vulnerable to stress, you sleep little, or you're genetically predisposed to feel more pain.
Lately, there has been a dramatic increase in understanding of this disease, especially since the classification criteria from the American College of Rheumatology in 1990. Researchers of the Euler Journal are focusing on the application of brain scans and cognitive behavioral therapy to help patients with fibromyalgia, and as soon as this has been approved, we at Alno Clinic will too implement these practices. Fibro patients waking up in the morning often fear that the pain they will experience will be horrible, and this will actually cause their future pain to be worse, and this will inhibit their ability to function. As you have seen throughout this presentation, the woman has been severely coping, and she could not cope with her daily life, or her job, or her children, or her husband, leading to depression and isolation. So, when the exact cause of fibromyalgia will be discovered, I hope that more effective treatments will be applied, and hopefully we here at Alno Clinic will be able to cure instead of simply cope with this condition. A greater understanding of this condition, as well as knowledge gained from the trial and error of different treatments, can narrow down effective therapies and form the basis for treatment guidelines for fibromyalgia in the future. Some of you may think, is this disease even real? If hardly any tests can prove that this disease is real, how do we know that the women are not simply over-exaggerating their pain, or that it's a different condition that they are coping with? However, every single-handed account of a patient that has dealt with fibromyalgia will tell you that yes, it is real. And the medical community needs to start accepting that, as well as with the insurance companies, with more understanding from both the medical community and from the population as a whole. We will be able to raise the awareness of this condition and help women and men nationwide. I was once a sufferer, but because of Alno Clinic, my life has changed. I was once a sufferer, but because of Alno Clinic, my life has changed. I too suffered, so thank you, Alno Clinic. I feel so much better now. Come to Alno Clinic now and banish constant suffering from your life. We will help you live an active, comfortable, and pain-free lifestyle. With specialized doctors, dietitians, and the best rheumatologists in the country, we will make sure you do not leave our clinic unsatisfied. Additionally, we offer Tai Chi classes, which the New England Journal of Medicine has recently dictated is extremely beneficial to fibromyalgia. Acupuncture, diet consultation, and the necessary drugs and antidepressants are also included in your package if you call us now. Get specialized treatment and come out refreshed. Call us at 903-66200-1287 and consult about prices and how we can help you. Alno Clinic. We care about your health.